For our next segment, please welcome the panel on Social Epidemiology, Public Health and Social Movements, moderated by President of the Milken Institute, Richard DeTizio.
Good morning. Well, we're going to pick up on a few of the themes that we just heard about. One thing I'd like to start as a framing reference is that the life expectancy globally on average was about 31 in 1900. And as we, 120 years later, enjoy life expectancy globally into the 70s, all of the advances in biomedical research which afforded that are sometimes going up against the backdrop of some social determinants which are starting to erode it. So we see for the first time the unwelcome trend in the United States that life expectancy has actually declined. So thinking back to a time, go back to earlier in COVID, when there was a moment when companies and countries around the world seemed to be cooperating in a way because there was a common enemy we hadn't seen before, and everyone was trying to fight it. And that level of cooperation has now quickly eroded back to companies suing one another and what preceded it. But I think there's a number of issues that we'd like to instill that sense of urgency in because they are socially eroding and corroding what we think of as our societal fabric here in the United States. So John, I want to start with you. I travel quite a bit in this role globally, and wherever I am in the world, invariably someone will come up to me and want to talk about guns. And last week I was in Japan. This is the week after, in the US, we had 3 mass shootings in 1 week, and a woman walked up to me and, in a very puzzled way, said, is it true in your country that you train 5-year-olds what to do if a gunman walks in the room to kill them? As bluntly as that. And I thought, first of all, the embarrassment of having to answer that, as I suppose we do, and then she said, and what happens when they get to 1st grade? So, I mean, the notion that when you look at the lens of someone outside the United States looking at this issue, where we have become somewhat immune to it, I guess, just given the frequency, how do you think about activating it so that it becomes an urgent social issue?
Well, first, I'm not a bit surprised that people come up to you that way because this is a uniquely American problem. I mean, we have something like 27 times the gun murder rate of any developed country in the world. And you'll see people try to blame it on movies or TV or video games, but the truth is, or mental health. But the truth is that people in Canada, people in Great Britain, people around the world are seeing the same movies, playing the same video games, have the same psychiatric admission rates as we do. The difference has nothing to do with those cultural cues. What it really has to do with the easy access to guns in this country, and that's what's unique about it. How you turn it into sort of a crisis is a question that obviously we've been grappling with at Everytown for years, and I think that the key to it is really creating a movement. After Sandy Hook, where 20 kids were killed almost 10 years ago in a Connecticut schoolhouse, as you may remember, there was a bill in the Senate that in some ways was a dream because it was co-sponsored by Pat Toomey, who was a Republican and got an A rating from the NRA, and Joe Manchin, a Democrat, who also got an A rating from the NRA, and the bill failed. And the bill failed with virtually every Republican voting against it, but here's the surprise, Democrats voted against it as well. And so what I learned from that was it was great to be a good lobbyist. It was great to be, you thought, politically astute. But the truth is, if you weren't noisy, you really couldn't actually change hearts and minds. And that's when our efforts, we merged with a very young grassroots organization called Moms Demand Action, which is now one of the largest grassroots organizations in the country, regardless of what issue we're talking about. And I think in many ways, it's the grassroots movement that we've built over these past 10 years that really helps move legislatures at the state level, certainly help move Congress, which is, you may remember, passed this summer the first gun safety bill in 26 years, with 15 Republicans voting for it and every Democrat voting for it over the strenuous objection of the NRA. So in many ways, the political calculus has shifted dramatically on this issue, and I credit the grassroots movement in a very large degree for moving us from where we were after Sandy Hook to where we are now.
Okay. So I want to go, Robin, let's talk about a success. And I think the teen cigarette use is down. It was 23% in 2000. Now it's 2 or 3% today. What do you think contributed to that success? What's working so well that only 20 years later has been such a positive result?
Well, thank you for that question, and it is a great victory. You know, we sometimes talk about the, and this is a CDC term, the full inoculation, right? So I think what has worked for us in the tobacco area is, of course, successful public education campaigns like the Truth Campaign, which have, you know, dramatically impacted young people in terms of the way they think about smoking. We can talk about vaping later, a new issue. But, you know, along with that is all of the work that's been done to make tobacco more expensive. We know that the most effective thing you can do to prevent people and help from smoking or help people be inspired to quit is to make it more expensive. So tax increases, access to cessation services, which have been very important, the right regulatory structure. So all those things working together. And then I think, and you know, you were talking, John, about creating a movement, is, you know, what we like to call denormalizing the behavior, denormalizing tobacco use, making it seem less prevalent, less acceptable in culture, and at the same time, normalizing the idea that it's okay to quit, that there's help to quit. I think the opportunity, though, that still exists, and I always like to say, is I know a lot of people, and we sometimes perhaps sound overproud about the successes that we've had, and certainly that stat on youth smoking is one we're very proud of. But we have a lot of health disparities in this country. And so at the same time, we have states like California and New York and Washington, D.C., and I imagine the people on the stage maybe don't know a lot of people who smoke. We have what we call Tobacco Nation, which if you thought of a T that started in Michigan and goes down to Louisiana and maybe from North Carolina to Oklahoma, where rates of smoking are still extraordinarily high because they don't have the full vaccine. The regulatory policy isn't there. The pricing isn't there. It's sometimes surprising to think that rates of smoking in some of those areas are as high as they are in, or almost as high as in China, Indonesia, the Philippines. So we still have a lot of work to do there, but I think we do know what works, and that, to me, is an enormous success.
Okay, one of the things that Dr. Gupta mentioned was this notion of stigma. Jesse, I want to talk to you about that. When my brother died of AIDS 27 years ago, the social worker came into the room with 2 pieces of paper. And one, she said, there aren't very many funeral homes who are willing to take someone who's died of AIDS. Here's 2 crematoriums you might want to call. And the second was a sheet on the NAMES Project, which is now the National AIDS Memorial Quote. And the 2 things I thought were, one, I'm trying to help my parents bury their son. I need to make those calls first. And then the second thing I'm supposed to do is go sew away my grief into a quilt panel. And I think that the movement was so, from a person in the middle of it, not afflicted but affected, the stigma of that just put us in a corner that was hard to break out of. So one, do you think that that's changed? And if so, how, relative to the AIDS community? And again, if you can just pick up on Robin's success story, what do you think would have made that successful if there has indeed been a positive change?
Well, Richard, thank you for sharing that story. because I think that is part of what we need to address the stigma of HIV. We need people who are concerned about HIV, who do not live with HIV, to literally share that story that you just did, that you are concerned about the 1.2 million of us living with HIV and the 1.2 million people that the CDC tells us are highly vulnerable to HIV. And that stigma cannot be addressed, cannot be broken down just by people like me living with HIV. This year is my 40th year living with HIV. And I can say that over these 40 years, I have seen impacts of that stigma be so constraining on people. I was with I did a webinar just a few weeks ago for the Center for Bioethics at Tuskegee. And a professor at Tuskegee told me that his sister, who was in her 50s and had just been diagnosed with COVID, was also diagnosed with HIV. And no one knew it. She had not told anyone for years that she had HIV. I was with a conference at the Congressional Black Caucus Conference just a couple of years ago, and a black heterosexual man who had been in the military stood up and said, "This is the first time I've ever felt safe because of you saying what I had just said, to actually stand up and tell people he had lived with HIV for 22 years. Without ever telling his family." And I think it's really impactful after 40 years for us to realize that social movements do not happen simply because we make noise, because we do make noise, as I think John just said. Making noise makes change, but the people hearing the noise are the ones that we are relying on to make the change. How many black people were in the United States Congress in 1964? When the Voting Rights Act was passed? They heard the change, and they made the difference, and that's why we need a movement to help us not only identify what needs to be changed, but for policymakers to hear the change and then make it happen.
Thank you. So I'd like to focus on some levers that we have and how to pull them. So Robin, I know one of the most successful commercials that you've done was the body bag commercial, right, which my colleague Jeff just sent me again yesterday. And watching that, and I want to go back to your time as an advertising executive, advise John, should we have a body bag in front of all of the gun manufacturers? Like, is there a strategy that can lean into some of your advertising background that would be catalytic towards helping Everytown and other gun safety organizations?
Well, I think the thing we're always trying to do, and our target is young people, and that was a incredibly successful, still today memorable ad that really tapped into the audience it was speaking to at the time. So if we can remember back to 2000 and Gen X and grunge music and rebellion and all of what identified young people at that time, that ad was incredibly powerful because it harnessed their feelings about not wanting to be co-opted or controlled by corporate America, and so placing those body bags in front of the headquarters of Philip Morris was an incredibly empowering way to say, I'm not going to let you, big tobacco, control my life. One of the things that I think is always important, and we do it today, is figuring out we have an issue that, let's be honest, young people don't actually care about very much. Many more, pressing things in their minds are on their minds. So we're always trying to find that connection. What do they care about, and how can we draw the thread between what they care about and our issues? So today, for instance, we know the #1 issue with young people is mental health. Obviously with many people, but in terms of what young people care about. What they don't know is the very thing that many of them are turning to address their stress, address their anxiety, because the tobacco industry has told them that, is vaping, nicotine. And so what we are doing today is helping them to understand that the very thing you're turning to help you with your stress is actually making it worse. We created, and it's all about how do you get people's attention to that. So we actually created an idea. It's a fake company. What if the tobacco industry actually told the truth? And they sold a product, instead of naming it Juul or Puff Bar or something like that, they called it Depression Stick, because that's what it actually is. Incredibly successful. We followed that up with something that we've got out there right now called breath of stress air, because literally every time you take a puff on a vape, you are inhaling a breath of stress air. In the past, we found out that you're twice as likely to get left swiped on a dating app if you post a picture of yourself using tobacco. So we did a whole message campaign around the idea. We called it Left Swipe That, because we know that, you know, smoking can be dangerous to your health, but it's also a killer for your dating life. And young people care about that. So I think, you know, it's finding those threads where you can take something that maybe seems too big to deal with, or I don't want to think about it because it's too difficult, and figure out how to connect it to something that people actually do care about and feel like they can engage with, because it's not too hard.
And look, there is no doubt about it, the gun industry has gotten a free ride in this country, and that has to stop, but it's really important to understand how extensively they've been inoculated. Congress, you know, in 2005 gave the gun industry blanket civil immunity. Just think if tobacco had had blanket civil immunity, you wouldn't have been able to sue them. In addition, Congress squelched research and wouldn't allow any federal funds to be used for gun violence research. Where would we be on tobacco if there was no research? I can go on, but this was, in some ways, I've always felt like the NRA and the gun industry learned from the tobacco wars.
They absolutely.
And they built a fortress around the gun industry. And what you have to do is pierce that fortress and really communicate to people that these are merchants of death. And that's a complicated business given the barriers, but part of it is litigation. And within every town we have a 22-person law firm trying to always navigate how to pierce these protections. And you put the industry on its heels, and that's beginning to happen. But you also have to stigmatize the industry. Talking about stigma. And that is something that I think is extraordinarily important and has been harder to do because of these barriers. But there's no question, for instance, you know, I think you can't talk about the industry writ large. You sort of have to have an enemy. We were very effective in chipping away at the NRA's brand. You've got to do that with the industry as well. And I would start with Glock. If you look across the country and look at the data, Glock is the maker of cheap guns in this country. Glock guns are the guns that end up at crime scenes disproportionately compared to other makers of guns. And you've got to start talking about not just the caliber of the gun, but who actually made the gun. And then you have to connect them to death. And there's no question about it. This is something I think tobacco has done incredibly well, and something the gun safety movement has to do as well.
Well, and thinking back to like the levers to pull, and a lot of what you just talked about is working through governments, and government has afforded this luxury to the gun industry. An interesting survey came out for the third year in a row. Edelman does an annual trust survey, right, which is, you know, tens of thousands of people globally, like who do you trust the most? And for the third year, given the backdrop of a global pandemic, it was companies with whom I have a relationship. Right? So it wasn't governments, which were really responsible for the distribution of vaccines, et cetera. It was companies. And now you've seen corporations step into social issues in a way that they haven't previously. So a few years ago, Citi came out and said you could not use a Citi credit card for certain gun purchases unless you demonstrated age and other characteristics. Very recently, Amex, Visa, and MasterCard have created a category so that you now know when a card is swiped.
Against their better wishes.
Yeah,
they did not
they're
vote
forced
for it.
to, but they're
yes, they were forced to. And there is no question about it. Look, we've discussed this. There's no question about it. I think when businesses step in to an issue, it's a really good social barometer of sort of where the public stands. Companies have tiptoed into this. Quite truthfully, Citi has probably been the best one. But, you know, for years, there's been a merchant code for florists, for bicycle riders, but there's never been for the gun industry. Just this year, I mean, we're talking about now months ago, there's finally a merchant code so that a credit card can identify what's being purchased. You know, an easy first step. You know, should you be able to use a credit card to buy an assault weapon?
Well, it should not be lost that the corporate response for domestic partnership benefits was based on the needs from the HIV community.
Yes.
Because we had too many people who were dying who actually did not have any kind of insurance. And so in the 1990s and the early 2000s, when domestic partnership benefits were being offered by businesses and corporations, it did help propel that very social movement. And just last week, the United States Senate passed the Respect for Marriage Act. That's because the social movement that was adopted in many ways, or at least the issue was embraced by businesses and corporations, started to show that the country was moving in that direction. And every time an organization offered domestic partner benefits, not only the HIV community, the LGBTQ community, but it said to the larger community, this is a place where social justice is valued. And that helped not only create committed employees, but I think also committed customers.
Well,
I
and
think
as
I just wanted
go,
to
please.
add, I think, you know, what we're all talking about here, which is a very important point, is we talk a lot about the social determinants of health and public health, but the commercial determinants are also very important. And that's where companies, the private sector, have a very, very big role to play. It's often talked about from a negative perspective, right? The tobacco industry and the commercial determinants of health that come from them pushing all of the costs onto society and reaping all the benefits, the gun industry as well. But on the opposite side, companies have a tremendous opportunity to influence these movements in ways they may not even be thinking about. If you are in the entertainment industry or in publishing or anything that helps to shape culture, you have an opportunity of how do you visualize these things to people? One of the things that we know, for instance, young people, when they see smoking or vaping in entertainment, in gaming, in music videos, are many times more likely, in fact, that's the initiator of smoking. Disney is a great example of a company that said, we're not going to show tobacco in our products anymore. Companies that we like to say we loathe smoking, but we love smokers. So companies that actually embrace smokers within their populations and say, it's not that we're not going to hire you or we're going to raise your insurance rates. What we're going to do is provide real access to cessation in our company. And so I think there's a big role to play from the private sector in how do you address the commercial determinants of health, which then have a huge knock-on effect to the social determinants.
And I think there's two lenses we can look at. One is in this hyper-competitive market for talent, and younger people in particular want to align their own value systems with that of the employer at which they work. So there's an opportunity here to lean heavily into that. And I think also all of you, people who are participants in pension plans and the like, those dollars are invested in these very companies, and as owners of those companies, equity shareholders have a voice. So I don't think we think of those levers to pull often enough, but I think we actually can. And to Jesse's point, whether it was on benefits for domestic partners, which led to marriage equality, like there's a path that we can see when corporations become involved, because let's face it, they are the most trusted entities right now, and they either do or don't want that responsibility, to John's point, but they have it. So they have to respond if they want to be competitive and continue the profit motive.
Yeah, and there's no question. Look, there's some real heroes in the gun safety world. I mean, Dick's Sporting Goods, which basically got out of the gun business. Walmart, which is essentially out of the gun business. They're real heroes, but there are still some real sectors that have to stand up right now. And I would say social media companies would maybe be the top of my list. I mean, we have seen, whether we're talking about retaliatory violence or whether we're talking about mass shootings like in Buffalo, the breadcrumbs of violence are sitting on social media. And social media has to make a decision whether they want to be part of a solution and actually prevent crime, which they could, because the data points are sitting there on their platforms, or whether they want to stir the pot, like YouTube did, actually, that led to, one could, I think, fairly say, the Buffalo mass shooting.
I have to say my mind just changed right now because the grocery store that I go to every weekend is right next to a huge Dick's. And what you just said has completely changed my approach because now I'm willing to go into Dick's.
Go to
I'm
Dick's.
telling you, until literally 20 seconds ago,
They've got a lot of
I
great
would be
products.
walking right by them. Oh, for heaven's sakes. But it is important to know that our organizations are very much focused on pushing social movements and advocacy, but advocacy is probably the least funded of not-for-profit organizations' efforts. And all of the corporations, including all of those that are sponsoring this institute, have charitable giving arms. But when we approach them, they're afraid to support advocacy, partly because they think it sounds too much like lobbying, but the fear of getting into something that could lead to a reduction in their profits or customers. But in fact, if you're supporting our advocacy, you're probably also supporting the opportunity for more people to embrace your corporate mission and your corporate values.
Do you ever find the challenge, like, do people think AIDS is over? Like, is that part of like keeping it very present in people's minds?
Yes, because someone like me is now living so long, and because we're not seeing Rock Hudson and his death on the front page. But in fact, we still have 15,000 HIV-related deaths in this country and 35,000 transmissions every year. And of those of us who are currently living with HIV in this country, 1.2 million, only half of us are achieving viral suppression that prevents the HIV virus from destroying our immune system and leading us to AIDS. So HIV is not over, but because it's become clearer that it is a black and brown problem and a Southern problem more so than it was identified publicly 30 years ago or 40 years ago, I think the health equity issue is what we really have to push in order for people to understand that virtually all of the issues we've been talking about in this institute over these last several days have a health equity approach. And HIV today is very much a black and brown problem.
And I would say that's
Absolutely
common to
true.
all three of us.
Yeah, I could just as easily have said, we call Tobacco Nation, this part of the United States that still has extraordinarily high smoking rates. I could have called it Diabetes Nation. I could have called it Opioid Nation. I didn't realize that AIDS is primarily a Southern problem now. It's, these are all very interrelated issues.
Could you speak about the targeting of people of color by the tobacco industry?
Sure, so there's a long history of that. So 85% of black people who smoke menthols. Why is that? There's nothing special about menthols that make them more appealing to black people, other than the fact that the tobacco industry for years targeted the black community, went around neighborhoods giving them out for free because they saw it as an untapped audience. At one point in time, black people had much lower smoking rates than the white population. It was a market of opportunity for the industry. Today, if you go into a black neighborhood, what you'll see is sign after sign in storefronts advertising Newports, right? The #1 brand. And that targeting of vulnerable populations is something that the industry has done in many cases. Gay people smoke at higher rates than the LGBT community smokes at higher rates than the rest of the population. Why is that? Because the industry for years targeted social events where LGBTQ people would go and actually have people in gay bars handing out cigarettes. So, I think some of these disparities some of them are, where you live is how long you live, right? We know that. but some of them are these commercial determinants that when vulnerable people are targeted by industries of opportunity, we see these disparities get even greater and greater. Certainly we know in the opioid crisis,
Yep.
that is a huge factor.
And John, let's go to some of the pricing tools we might have.
Yeah.
Because I think that if we know that most mass shootings seem to be perpetrated by younger white males, maybe under 21, under 25, they probably don't have $5,000 or $10,000 sitting around to buy a gun. Is there a way to affect tax legislation or something similar that would increase the price as at least a prohibitive measure?
Look, I think that, I think again about the tobacco industry, both place restrictions and taxation. Place restrictions have become thornier and thornier because of the Supreme Court's recent decision in the Bruin case, where in fact the places where we have had place restrictions are now more vulnerable than ever to attack. Pricing has not been used, I think, vigorously enough. I mean, the one example is in Seattle where there's a $25 tax. $25 is not enough, you know, on a few $100 gun when I think of what tobacco did with pricing, which it just became sky high. So I think there have to be more taxing. Unfortunately, we've got this knotty little problem that neither of these other two movements have. It's called the US Constitution. And regardless of how you interpret it, every move that we make strategically has to be thought through. Is it vulnerable to constitutional attack? And in fact, that's getting to be a wider problem, not a narrower problem. And so there's a point at which you could obviously see an attack if you imposed a really significant tax a la the tobacco industry. Are you violating somebody's constitutional right to purchase a gun? That is a layup of a lawsuit on the other brought by the other side.
Well,
And so you have to be really strategic and thoughtful about, are you basically handing your opponent, you know, a beautiful case that will actually cripple your efforts?
So go through, I know in your own background, you've worked on immigration, marriage equality, infrastructure. Are there other strategies that seem to work in those instances that might, across our panel, be shared?
So I think that the two movements that I've taken most from are probably the marriage equality movement and auto safety, two very different movements. And you know, what influenced me in marriage equality, and as you say, I was very involved in that, was the decision to go state by state after the failure of federal efforts. I mean, the first efforts of the marriage equality movement were based on what you could get out of Washington, D.C. What they got was DOMA, not exactly what they were looking for. And they made a decision that in certain you know, held cultural sort of legal issues, state by state is a better way to go, whether it be state by state legislature or whether it be state courts. And in some ways, those are closer to the public and they basically influence, hopefully, the Supreme Court at some point or Congress. And I think it was a recognition that sometimes and often Congress is the curtain raiser, but sometimes it's got to be the finale. And so after the failure of the Manchin-Toomey legislation, which I referenced before, we basically said we're going to do what the marriage equality movement and went state by state and have had incredible success on a bipartisan basis. What I've drawn from auto safety is essentially the idea, I think, with guns is we're not going to, there are 400 million guns in this country. We're not going to put the gun industry out of business, but you can perhaps force them to create a safer product. So what's a safer product? I mean, think about the technology on your phone. Well, what if you had a palm print recognition gun that only the rightful user could actually fire? I mean, think about the fact that you'd no longer be reading about 4-year-old gets a hold of their parent's gun, negligently stored, you know, in their night table, and ends up shooting themselves or their brother or sister. Think about the fact that one of the most reliable ways of guns getting into the black market is through home burglaries and car thefts. And there would be no currency in those guns anymore. They couldn't be sold in the black market because they'd have no value. Think of the suicide rates among teens that we're seeing escalate right now, where do those guns come from? They come from their parents, or their uncle, or their aunt. And so I think that you could make guns far more safer in the same way that, seat belts are now, considered, something you don't even question. And, my car's got more safety features on it than, I probably understand at this point. But think, 25, 30 years ago, I mean, cars were being made out of the thinnest metal and had none of these safety features. And though that's just one example of what guns could do, I'll give you one other simple one. I mean, the trigger on a gun can basically be pulled by, a 1-year-old. Well, there's no reason why it has to be weighted like that. So I think in some ways why I think of the car industry is I don't think you're going to eliminate guns in this country. Sadly, but I don't think you are. But I think you can have a much safer firearm.
Well, I know we only have a few minutes left, so I want to end on an optimistic note. Jesse, I want to start with you. I read you had a beautiful letter last week for World AIDS Day about your 40 years living with HIV. Tell us something that you're most optimistic about in the future.
Well, I'm a big optimist, and I believe, as Martin Luther King did, that the arc of history is always toward what is right. And I don't mean the political right. I mean what is just and what is true. And though we have battles along the way, those battles ultimately, I think, lead to that truth that at least all of us, I think, are hoping that we will achieve. But I think in order to get there, we have to have a multidimensional approach. We have to have a grassroots strategy, we have to have a legislative strategy, and increasingly we have to have a litigation strategy, because Dobbs and the recent Braidwood decision around religious freedom and PrEP are very dangerous, but the Supreme Court is the one who made a constitutional interpretation that marriage equality was based in a constitutional concept. So we have to continue to do those. The legislative advancements and the litigation advancements would not happen without the grassroots efforts that our movements do.
Okay, thank you. Robin, what are you hopeful for?
Well, in our world of, fighting the tobacco epidemic, I see an opportunity, and it's growing as a movement, to shift our thinking from, we often call it tobacco control, which accepts as a frame of reference that the tobacco industry will always exist, has a right to always exist, tobacco will always be with us, and our job is to put a fence around it as best we can and control it. Where thinking is now really shifting is to this idea, sometimes called tobacco endgame, of the tobacco industry doesn't have a God-given right to exist, especially for a product that legitimately is probably one of the, if not the most dangerous product in the world, with no social benefits to it, kills 50% of all of its regular users. And so what if, right? What if all of our efforts started to shift to how do we move society to a world where tobacco is no longer normal, where the right carrots and sticks are put in place, because it's definitely not about prohibition, and I think it's very important to explain that, where the right carrots and sticks are put in place to shift culture such that we totally denormalize the idea of tobacco, and we put the right regulations, access restrictions, pricing controls in place, so that the ability of young people, who are the lifeblood of the industry, are no longer the kind of feeders. And, for instance, put place things like in New Zealand, for example, they have legislation that will restrict people who were born after a certain year. They will never be able to buy tobacco. So I think those are radical ideas that I'm very, very excited about.
Okay. John?
Yeah, look, when I first started working on this issue with Mike Bloomberg, who I continue to work for and who's been the most courageous leader on this issue, this was the third rail of American politics. There was no question about it. I mean, regardless of who you were, Republican or Democrat, progressive or not, you shunned, this issue. You weren't going to run on it. You were going to run away from it. 10 years later, thousands of people are running on this issue. 15 Republicans, including Mitch McConnell and Lindsey Graham and John Cornyn, voted for the bipartisan gun legislation in the Senate. None of them lost their jobs for running on it. And they realized what we've known for years, which is this is a potent political issue, particularly in suburbia, where most elections are won and lost, and particularly among women, young people, and black people. And this is an entirely new political reality compared to 10 years ago.
Good. Well, I want to thank you for being on the panel. I want to thank you for lending your talents and your passions to these very complex issues, and the Institute will be there to continue supporting as well. So thank you all.
Thank you.
Thank you.
Thank you for attending this discussion. Please make your way to the next session. We gratefully acknowledge the participation of the following organizations whose generous support makes this summit possible. We thank the Milken Institute strategic partners for their year-round support of our work around the world.